Oh. Are we waiting on?
He's coming.
Who's that? Gordon? Oh, there he is. Well, if you could forgive me for being 45 minutes or 50 minutes, I don't even know what time it is now, but late and everything. There's lots going on in this building, and lots of moving parts that are changing, and they're changing pretty rapidly. But thank you for bearing with us, and let's get started. I'm going to sit down. These great people that are with me are, they're going to have to stand right now, I think. Okay. The first thing is just this. You know, we have a drug crisis in this state like you can't imagine. We have a drug crisis in this country like you can't imagine. We got to do something about it, don't we? We all know that. And we all know that it, left unattended, it will cannibalize us at some point in time. It may even very well be doing that right now. I mean, we see the overdose rate continuing to rise. We see the death rate continuing to rise. We have to act. Now, the number one thing that will no doubt help us is a better economy, more jobs, hope. We got to have hope. That's all there is to it. If you have nowhere to turn and despair, it's easy to drift into drugs. We all know that. But that alone is not going to get us through this. And so therefore, now we're bringing together an even new and different type of effort. We're bringing together this, and I'm going to read this. But we today are going to name a director of DHHR, a director in the DHHR offices that's going to be our director of drug control policy. Now, and that is going to be this great man right here, and he has a very, very distinguished military career. He's a doctor. He's a worker at WVU today. It's Dr. Michael Brummage, and Michael is a superstar in lots and lots of ways. But what we're going to do with him is do a coordinated effort within WVU and all the resources that we have available to try to figure out this problem and address it and do something about it. Now, we're going to do that statewide. But in addition to that, we're going to do this. And this is really the driver of the idea. We know that it takes way more than an aspirin and a Band-Aid to fix this problem. It takes treatment facilities and social workers and better law enforcement and the technology of our neurosciences and all the stuff that we have available. It takes all that, and we know that, don't we? You know, it takes money, lots of money. Nobody has ever been able to really solve the riddle, have they? All we do is do a little bit of a coordinated effort, but nobody really solves the riddle. Now, what we're trying to do is something that will be a nationwide solve of the riddle. So let me just tell you what we're doing. In sitting in my office probably 3 weeks ago, we were all sitting there and everybody's going a lot of different ways. Now, we're no question going to employ the very smartest and the best to really go at and solve this problem. But here's the thing that's going to be different. We're going to pick a county in the South, and a county in the north or a county in the eastern panhandle. We don't have enough money to fight the battle on all fronts at all times right now. We're going to have to do everything we can to maintain and make things better statewide. But we've got to come up with a model that works. And so we're going to pick that county in the south. And in all honesty, the county in the south is probably going to be Wyoming County, because that was my pick. And we're going to pick a county in the eastern panhandle or the north, or the north, and we're going to try to do everything we can to put together a playbook that solves the riddle there. And then let that in itself expand to other counties throughout our state, while at the same time we're doing everything we possibly can to protect all of our counties in our state and do all the good that we can possibly do. But today, there is no humanly way that you can fight this on 55 fronts at the same time and win. We got to have a win somewhere. And we've got to have a playbook to how that win works, and then go from there. So that's basically it. Now, I would like you from this point forward to ask questions, and I'm going to direct those questions to the superstars, but you just think, we've got a medical facility at WVU that's on the move like you can't imagine. You can't imagine what they're doing there. I mean, for crying out loud, they're becoming, because of all these people, but especially this little rascal right here, I mean, they are becoming world renowned. And so, and what they're doing may very well solve the riddle for all of us throughout the world. But we've got to do something within West Virginia, and that's where I come into play. And so, all these great people here, ask your questions. If I can't answer them, I'm sure I've got the expertise behind me to answer the questions. Yes, sir, Brad.
I see what you're saying, but does an epidemic respect county lines?
With no, it does not. I'm saying we are not going to lessen our effort statewide. Now let's make sure that we report this correctly. Our effort statewide is going to go on and even get more intensified. But we're going to fall back in 2 different counties and try to put together the playbook that will work there.
Do you have a tentative action plan in mind, or do you need to do more research first to kind of figure out what would be the best approach?
I'm going to let Bill go.
We started this 2 weeks ago, 3 weeks ago, and the governor's absolutely correct. He was the one who suggested that we develop demonstration projects. So we're in the early stages of looking at data and trying to determine where we want to do this, although I believe we're going to do it in Wyoming County now. But it is a little too early to say how this is going to look. It's going to take funds. It's going to take money, which we're looking for hard. The governor also said in the same meeting, we can't fight this battle with rubber bullets. We are in some ways unarmed. Now, we are identifying additional dollars to put into this at DHHR. So we're developing a budget. We're looking at approximately $10 million at this point to start this effort with. It's not enough. It will not be enough. But we're going to raise money through foundations and other places, if possible, to add to this picture. So these gentlemen, I'm proud to be partners with. We have 2 best minds in the state right here with regard to this problem and knowledge of this problem. So we have the tools. We need the additional money to make this work.
This early in the process, then, do you have a target date for when you might want to start doing something?
We do not at this point. We will bring that out as we develop this plan.
You know, I'm an impatient guy, and And we've got to move on this. That's all there is to it. Understand just this. Let's be fair. Let's really be fair. The efforts that have been made to date have failed. That's all there is to it. You know, are we guaranteed that this is going to work? Of course not. Do we absolutely take resources away from other areas of our state in order to perfect and make this work? Absolutely not. Report it the right way. The right way is just this. We're going to maintain and do everything in our power in every single part of our state to try to stop this problem. But we're going to fall back, find some extra money somewhere, fall back, and try to create a model that will work, for sure. We know everything we've done thus far has failed. We've got to come up with the perfect model and then let it spread and let it fix this terrible problem.
Don't take this the wrong way, but are you saying that this is an admission of failure, considering this has been established, I don't know, about 4 months ago? How much of this?
No, Dan, I'm talking about a problem. I'm not talking about an admission of failure in the last 4 months. I am telling you without any question, this problem has been going on for years. I inherited this problem, and it's just there, and it just seems to get worse. Now, I'm a guy that doesn't believe in just shoving things under the rock and saying, well, the economy's better and hope's better, and maybe we can even find a statistic that will say we had a lesser rate of increase in deaths, you know. But I don't need a statistic. I need to solve the problem. I need to solve the problem. And the problem is eating us alive, and we got to stop it.
If you'd allow me a follow-up, how much has changed from when this office was first established to now? Is there any progress to report on that?
I think, Bill, you got to go there.
The office was established through legislation last year. It was established with no funding, so we started out trying to pull together funds to develop the office. We hired a director in September, Jim Johnson, as everyone knows. He ultimately decided what he really did want to do was retire, and that was 100% his decision. He just decided after a few months he really was ready for retirement. So we...
Now, Michael, you can't do that.
No, sir. So we started pulling together money and moving as quickly as possible. So we haven't had a real tenure, but I think what the governor's referring to in terms of failed, this office, no one expects anything to happen very quickly. We failed with regard to the drug problem in West Virginia, and other states have as well. The United States in total has a drug problem, and it's worse in some states than others. West Virginia, we have a serious problem. It's an epidemic. And so we failed with regard to stopping that problem over the years, not just since this bill passed.
And wait a minute, remember one other thing too. Remember the state of the state the first go round. Remember throughout all the time what I said that I wanted to do was propose a 5% bidder's fee on all the successful road work. And it didn't come to pass. And that would have given us substantial funding, maybe to the tune of $120 or $150 million. I really pushed really hard to get that done. We didn't get it done. So now we fall back on another idea and another approach. But the reality is just this simple. We get how dire this situation is, and we got to fix it. We've got to fix this situation. Yes, ma'am.
Governor Justice, I know that all of our Huntington viewers are going to be wondering why Cabell County isn't one of the focus counties. I mean, it's the epicenter. Huntington right now is a city in crisis. Why have you decided not to make that one of the
Let me say this. First of all, I'm a Marshall graduate, and I spent a lot of great days in Huntington. And my wife's a Marshall graduate, and my daughter's a Marshall graduate. And so we spent an incredible amount of time there, and we love Huntington beyond belief, and we recognize that Huntington has a really serious problem. That's why I brought the Guard in a few months ago. We have an incredible problem in Huntington, but to be just perfectly honest, it's just this, is we need a win here, and we need a model, and we really and truly, I don't think, can tackle trying to put that together on the magnitude of the size of Huntington today. You know, that's why we're going to pick a smaller area and try to make something work in a smaller area with funds while we're still funding everything in the effort in Huntington. And this is not going to be a study that's going to go on for years and years. This is something that I want to try to move forward, and once I see that it's going the way it's going, then, and the magnitude of the cost of the way it's going, then we can equate that to where we try to run that program from a standpoint of statewide.
And if I could, there are going to be more seats at the table. Our primary partner in this is WU, and I'm thrilled to have them as partners. I actually called Clay the morning or the afternoon after the morning meeting with the governor when he suggested this approach, and everything seemed to fall in place. They were all in immediately. But there will be other relationships, other partners. Marshall will be a part of this in some way, I'm certain. Marshall is doing some extraordinary work right now with regard to the quick response teams and the LEAD programs. We're going to replicate some of what they're doing. So they're kind of ahead of the game here in terms of communities who are taking action and moving very quickly, or as quickly as possible, to try to deal with this problem. So we're going to use their knowledge and what they have done, and we're going to replicate something.
One more question too, just to follow up. Can you also talk about, if you have one out, and have a timeline for how long you're going to be focusing on these comments before you think you might come up with a plan to expand it?
I'd rather not get into that until we actually get into
I will.
to that.
I will.
The governor will.
You know, timeline really needs to be in a matter of months and not in a matter of years. The timeline needs to be quickly. We need to go in and test and come up with some level of where we're seeing real life success and we're understanding the real life problems, you know, and we need to get that done quickly, months.
Can you talk about your choice here and what makes them ready to help you out and do that?
I think somebody here is going to have to answer that because these guys are so much smarter than me, it's unbelievable. Clay, go.
So let me just make sure I understand your questions about climate change. So I would say that we have a really wonderful sort of leadership group in DHHR with Bill Crouch and Jeremiah Samples, and certainly in the Bureau of Public Health with Carl Gupta. Mike Rummage is somebody who is well known to us and to me. We were actually dorm mates in Borman Hall many years ago. Mike has a distinguished military career, is an MD, has an advanced degree in preventive health, and has also got a public health background. He is not only the Putnam County Commissioner of Health today, but he's also a real champion for public health in our state and is an assistant dean for public health in Charleston. Mike retired as a colonel in the Army, if I'm not mistaken, and has a very close relationship with Tom Thomas, who is the president of the Uniformed Services University for Health Sciences, and Eric Schoonmaker, who's a former Army Surgeon General. And we have been working together to try to bring holistic solutions to health and the opioid epidemic, focusing on chronic pain and using non-narcotic approaches to chronic pain. But as I talked to President Thomas, there is no kind of person who is as committed to this state, who has the background in operations and sort of connections, networks, as Mike Rummage does. And it's just, I think it's almost a fate, a destiny effect that he is back here. And Mike has been leading a very, very large and successful harm reduction clinic here in Kanawha, Putnam County. He has really championed the adverse childhood experience approach, looking at traumas in childhood and resilience as an offset to this, and has also been very, very involved in the public health of the state. So we are in spectacularly good hands, and we all stand here to support Mike and Bill and Raul and the leaders to try to bring all of the assets that we have, including some of the technologies the governor articulated from our newest recruit, Dr. Ali Razai, who is leading our Neurological Institute, who is quite an innovator around this problem, opioids. But I think this is much more than just a medical problem. If you think about this like a weed, we think a lot about the top part, we think about naloxone and medication-assisted therapy and approaching harm reduction and control of narcotics and pain reduction approaches. But really, this is a problem that is an important opportunity for us to get at the root. And the root, as the governor suggested to me, is despair and hopelessness and isolation and a mindset of scarcity versus a mindset of abundance. So President Yi has three pillars to the university: health and healthcare, economic development, and education. And this is an opportunity that gives us an ability to bring all of these elements together to a targeted community and county to try to rebuild communities of hope and changing mindsets so that West Virginia can not only help reduce the problem for us, but so that we can be the light to help the entire world, because it is a problem that needs a lot of help.
What do you view as existing staff and programs in place that you've kind of deployed to this effort? Do we hire some new people, create some new programs? What's the thought?
We absolutely do, and we have had an effort going on supporting and assisting a lot of the community coalitions in the state, including Brandon Dennison's program, Fulfill Development Corporation, Dino Beckett's program, Sustainable Williamson, Try This West Virginia, LaDonna Taylor's program, Sharon Lansdale's program. So we are trying to be the wind in the sails, but I think that we're here now to support Dr. Brumage, Dr. Gupta, and Bill Crouch in their efforts to help, and we will bring the assets that we have in a way that will do the most good for the communities involved.
Dr. Brumage, you want to say anything?
Well, I'm tremendously honored to have an opportunity to do this, and I'm very touched by the kind words and the confidence of the people around me, and especially the governor. There's a lot to do, and there's a short time to do it. And I think there's a number of things that we can do, exactly as Clay was talking about, to get at the root of this problem. So I'm very excited about this opportunity, but I go in very sober, knowing that this is a tremendous problem that we have to tackle. One of the books that I just finished reading is one called Chasing the Screen by Johann Hari. And in his book, he concludes with saying that the opposite of addiction is not sobriety. The opposite of addiction is connection. And that's where I'm going to be focusing on, the connections that we can make to connect people back to their families, to their communities, to themselves, and to connect all of the academic institutions within West Virginia University, Marshall University, so that we can bring all the resources to bear to really help the communities that most of them.
If I could just add and make sure we're clear, the governor's point that we're not ignoring any counties in West Virginia. We're going to replicate the quick response teams, the lead programs out there. We're going to tackle this problem statewide. Dr. Gupta has laid such a great foundation in terms of the epidemiological work he has done and looking at the science behind what's happening and developing a profile for addicts that is very important in terms of practicing physicians in West Virginia and across the country. So where I view us right now with regard to the state of West Virginia is really looking at turning a corner on the number of deaths we have. That's our first yardstick. Are we being successful? And the second is getting folks into treatment. And the quick response teams in Huntington, and the first 2 weeks of that program, they had 19 people in the treatment. So we're looking at numbers there, trying to get better data in terms of whether that's going to be sustained, whether those folks stay in treatment, et cetera. But we're gonna look at the entire state of West Virginia and provide assistance to those counties. So the demonstration projects are separate, and we'll keep you informed of those as we move along. But we're not going to ignore any counties or any communities.
Yes, sir.
Given how rural Wyoming County is there any consideration that what works in such a rural population area might not be able to be replicated in Huntington, Charleston, et cetera?
Sure, it may very well be possible that it won't work somewhere else. But we've proven how to not figure it out in every place. We're going to go to a more populous county in the north and a rural county in the south and try to figure out the problem. Let me say one other thing. Doc, when he came to the office 3 weeks ago, and we sat down, he said, we've got, his words I think were, we've got to act now to stop the deaths. Am I correct? We've got to give the right tools to our first response teams to be able to stop the deaths. Well, absolutely. That's ground level. That's ground level. But we've got to go way, way, way beyond that. I mean, really and truly, I can do things today and stop the deaths. Maybe not stop, but stop the increase of deaths. I can do things today that will make some statistic improve. But what I'm trying to do today is come up with an answer to the problem. An answer that will be looked at from a nationwide, eyes that says, West Virginia has solved the problem. Maybe we can't do it, but we sure as the dickens need to try to do that. Rather than come up with a statistic increase that I can come and brag to you about when I know we're losing the war. We don't need to just win one fight. We need to win the war, and this war is eating us up. Yes, sir.
Secretary Crouch, you said that since the office was started with the budget, we're pulling together money for it. Can you tell us how much you pull together so far? And Governor Justice, with your budget, reduces state spending for Medicaid quite a bit. Has there been any thought of putting that money as a shifting to other projects, shifting to this office?
You've got to answer that whole question.
We're looking at.
I'm telling you, these people are smart.
We're looking at all of DHHR in terms of possible funding. We're looking at every line item, how we spend our money, and we're making sure that that money is spent wisely and efficiently. If we can pull money out of any line item in DHHR, we're doing that. We were lucky to have an increase in our FMAP, our match, our federal match, and that notification actually came after we had submitted our budget to the legislature. So there was an increase for every half point. It's $15 million for West Virginia. So after that submission of the budget, we got notice of an FMAP increase. The result in that, and those matches change yearly in some cases. So we had an increased match in some areas, but the net there was about $12 million. So that's why I said we're going to take $10 million and we're going to use that to fight this problem. Between last July, I believe, when the bill took effect without funding, we started looking and pulling together a couple of positions to start this program. That's not an easy thing to do in government, but I think we're going to be able to find more positions and more resources to do this. That's my focus. The governor has asked me to make the drug problem my focus, and I'm doing that. It's a health problem of unbelievable proportions. It's also an economic problem in West Virginia. It is hurting our economy significantly, and it's a social services problem. 83% of our children in foster care are in foster care because of the drug problem.
Y'all listen to this really closely, what he's getting ready to say right here, because I was going to follow up with this, but he can say it 1,000 times better than I. Just think of the magnitude of the cost, the economic, deterrent that this is causing, but tell them about foster care, please.
We are out of foster care families in many counties. We can't find additional families who are willing to take these children. We're using extended families. We have more grandparents raising children now in West Virginia than we've ever had, and per capita, we have more children taken out of the home than any state in the country. We have a crisis with regard to child care. So we're actually, in terms of finding money and finding and fixing the budget issues, I'm also taking positions and adding to counties, giving counties that have a very high caseload in terms of child care, in terms of CPS workers, and adding positions to those counties so that we can help them and give them more individuals. We've got some counties that have 30 cases per caseworker. That's too many. They can't juggle those. They can't go before the judge and be informed because they have so many cases. They can't do the work. So I'm fixing that. That will be fixed within the next month or two. So I'm moving vacant positions and pulling positions and moving those where we need those to take care of the child care problem. So it is not a simple, you have an office of drug control policy, now fix the problem. It is much more complex than that.
Can you just imagine, let me just say one thing. Can you just imagine a runaway problem that affects our children the way this does? To where kids are displaced all over the place and we don't have anyone to really care for them. What's their chances? I mean, really, what's their chances? It's really bad. The cost is astronomical and it's really bad. Yes, sir.
I made my question really brief at the beginning, and I'm not sure I explained it correctly. What I'm puzzling about is the drugs would seem to be global across county lines, and those who suffer from addiction would seem to be global across county lines. So I'm wondering about the challenges of measuring success within a particular county.
We will have to look at that. There is no question, and it could be that these demonstration projects are a community more so than a county, and we expand outward from there. But the first thing we have to do is stop the flow of drugs into that area. So we'll be working with DMAPs. Again, we have military guys with Dr. Brunich. We will work with DMAPs as a part of the initial steps of those counties in terms of stopping the flow, and then begin to work, as Clay says, from the bottom up and work on the root problem and see if we can make change.
I mean, just let me ask one thing. Just think about this. What if I were to ask you? What if I were to ask these people here? Is there anybody in here that knows without a doubt exactly what should be done to stop this problem? Anybody that can truly in their heart say, I know positively this will solve the problem. And the answer is no. No one, me included. You know, what we're going to try to do is, as we try to perfect these projects, we're going to learn. And we're going to learn what will work, what won't work. We'll learn the cost. We'll learn a whole lot of things. You know, whether it be a bombarding of education in our elementary schools and middle schools, or whether it be law enforcement, or whatever it may be. But we'll learn, and we'll perfect something we think will work. I'm telling you, this is a gigantic problem. And there's not a single soul standing in this room today that will say, if you do this, it'll solve everything. This is a monstrous problem. And I have absolutely made up my mind some way, somehow, we got to stop this. Now maybe we won't be able to eradicate it, but we can sure make a dent in it, a big time dent. This is not going to be a dent with a ball peen hammer. This is going to be a dent with a sledgehammer. And we're going to do it.
Is there a point between a year ago and now where the tipping point is just, you're pulling your hair out or whatever, something changed?
No, I mean, really and truly, here's the brass facts, is a year ago, and let's again be fair, I walked into a house burning in every direction known to man, and you had to stabilize the patient. I mean, you had blood shooting everywhere and the patient's leg torn off and everything else under the sun, and you had to do something to stabilize the patient. A $500 million deficit, an outlook to go to 772, I mean, nowhere to turn. Rainy day, you couldn't turn. I've been through it over and over and over, but it's just fact. It's just fact. Now, we have made unreal progress, fact again. And now we're in a situation to where we've got the patient stabilized and everything else, and now we've got more to do, a lot more work to do. And so let's get at that too.
I will add, one of the things that happened in the last legislative session was around drum fund, and we're going to have over 300 more treatment beds online, so that's going to help. We also got an SUV waiver from Medicaid, which is going to allow us to pay for some of those services that we previously could not pay for, that were not reimbursable under Medicaid.
Well, and another thing is, and Secretary Crouch has already said this, but we're going to bring the drug companies in. We're going to bring anybody and everybody in to help coordinate and help this effort of what we're trying to do.
Governor, I have an unrelated question here. The House passed a bill about a week ago that said if anyone steps down from office in the midst of a term, they have to be replaced by someone who's in the same party they were at the time of the vacancy, not that they were elected as. You vetoed that bill last year. I want to know if you're planning to do the same thing if it gets your desk again.
Help me out there a little bit, Mike. Come up here and help me out just a little bit here.
I couldn't hear the question.
Okay. Jake, if you'd go again.
The bill says if someone steps down from office in the midst of a term, they have to be replaced by someone within the same party they were at the time of stepping down, not at the time they were elected. I.e., if they switch parties, they need to be replaced by someone within the party they switched to. The governor vetoed this bill last year. I was wondering if he's going to do the same thing again.
I don't, we haven't seen that bill yet. I can give you my personal opinion, but I'll defer to it. I do. I'm trying to think. That was like the case of the senator that resigned, switched party. And they're trying to mitigate against that. I like the rules it is now, and I think the governor will probably do the same thing.
So you think that someone should be replaced with the party they were elected as, not what they switched to?
No, the party they switched to.
Okay. So you would probably, your opinion would be that you would vote for the bill, or you would sign the bill?
Again, I'd have to see it. We're focused on a lot of other things.
And I too, I have not looked at it at all.
Yeah, we've not looked at that as...
That's why I called for help. I've not seen it.
But I remember the case, and it's a policy decision, that we would tend to stay with the law as it is.
Trust me, we got a whole lot bigger issues to deal with than that right now. That's for dadgum sure. Yes, sir.
I couldn't help but notice the people in the red shirts here on Friday. Any progress on dealing with that issue? Not the red shirt?
Well, let me say this, and I don't want to get in the weeds too terrible much, about the situation with the teachers, but I do want to comment. Okay. First of all, and I say this proudly, but there could never have been a governor, no way could there ever have been a governor that stood more staunchly in the educators' arena than me. No way. Let's just think about it. We have changed things in the last decades that were haunting us like nobody's business. Think about it. All this unnecessary testing that was going on like crazy, the A through F grading of our schools, we got rid of that. We put things back more into local control than trying to do it all out of a Charleston bureaucracy. And we even changed and make it more workable, the calendar. Now, we've got a great State Board of Education today, and they're working as diligently as they can to do good stuff. Now, if we had done nothing more than that, I would think from an educator standpoint, you would be terribly appreciative and terribly grateful. If nothing had happened more than that. But the reality is just this. Our teachers need to be paid more money. They do. That's all there is to it. We have 700 classrooms in this state without a teacher. It's bad. We're not really competitive with other states. Bad. And everything. Now, and if you're that teacher, you're struggling to get by. Now, here's the real deal. You got to run this state, and you got to be prudent in what you do. The one thing we can do that will really just harpoon us is if all of a sudden we get up on top of the wave and we start moving forward and we do things that are going to be trailing with us no matter what happens, and then we find out that the wave is not quite as good as what we thought it was, and then all of a sudden we slip back into the terrible, dire circumstances we had before. Now, my thing is just this, and I take real issue with this. Last year, when I proposed the 2% pay raise to the teachers, what happened? What really happened? At the end of the day, and if you want just the truth, and that's all you're going to get out of me is the truth, there was many a Democrat that were not on board. There were many Republicans not on board. And when it came to crunch time, and this is all there is to it, not in March, but in June, when it came to crunch time and everything, what happened? What happened? You know, many from both sides of the aisle dove in the ditch in regard to this, and it just evaporated. Their 2% raise that I stood for like nobody's business and went to the mat for evaporated, and here's how it evaporated. And we can say what we want, but this is just it. The Senate was all on board. All on board. You know, it went to the House, and the Republicans had 26 to 30 or so votes. Now, there were votes for Social Security exemption. There were votes for a 2% pay raise. There were votes for veterans exemption. There were votes for a rebate check to the very poorest of all of us. They had 26 to 30 votes. Half, almost half of their votes. And at the end of the day, because of tax reform, it was only there for the people that had an income less than $100,000. So really a tax reform for the middle class and the lower class, or the poorer people. And you know, because of that, it came ringing down to me that of 36 Democrats, they only had 3 or 4 that were going to go with this. And then it all died. Now that's what happened. Now we have a situation to where the Republicans and I are trying to come up with a plan that's prudent. We're working diligently right now on PEIA, and we're working to make this thing better. But the reality is just this. If you go look now you have the Democrats running through the streets in a lot of ways with a big banner saying, we're for this, we're for this. Well, where were they before? Where were they? And you know what the difference is? Election year. That's all the difference. You know, where were they before? Now, in my opinion, what we need to do, and we just got through, and the reason I'm late here is because Tim Armstead and President Carmichael and all of us were in that room right back there, and we were working like crazy on just this. All of us want more money for the teachers. Every one of us wants that. every single one of us knows the teachers are underpaid, but all of our state workers deserve a raise. All of them. And so what we're diligently working on back right now is ways to improve PEIA. Some way, somehow, it came down on this medical situation, that making it mandatory and raising $25 a month to whatever and all that. We got all that out of it. As far as two incomes in a family, you know, to where we put two incomes together and they were state workers and they had $40,000, now they're paying a premium on $80,000, got it gone. Now, but there's more we can do. And that's what we're working on. We're working on just this, to come up with a plan that gives more back, but comes up with a plan that is prudent in what we're doing, that we won't expose our state and we won't kill us in the future and take us off the wave. We're working on PEIA, issues to try to make that better. And you will see something come out of the Republicans in the very near future that is going to be a wonderful package. But in the meantime, I would just say just one thing, and that's just this. Judge me by my deeds. Look what we've done to help education. Look at my commitment to help education. For God's sakes a living, let's put our toe in the water, and before we run and just jump in the water, and then all of a sudden decide we're in a heck of a mess, let's put our toe in the water, and trust me that if things continue to improve, we can just do more and more and more. These people need us. The teachers need us. All of our state workers need us. But we need to be smart right now and not make a heck of a mistake.
So you talked about having a great school board. There's been a push to possibly put constitutional amendment that would change how the board is decided, so that you were going to having people in the state elected or some other board election. Have you put any thought to that?
I put a little bit, and I would just say just this, first of all, who in the world is going to run for a state board of education and everything and get nothing for it? I mean, they're not compensated and everything. Who's going to do that and run a statewide election or a regional election? That becomes not responsible. That I think that could happen. And the second biggest thing is just this. You're going to get special interest groups seated on the Board of Education. And I don't think you want that. I think you have an unbelievably good state board of education today, and just look what's happened. Look at what's happened, I think we should be very proud of the people that we have there today. Okay, we're done. Thank you. Thank you, guys.
Since we have a comment,